Hello and welcome to Healing Spaces Design Dialogue for Mental Health, where we explore the intersection of behavioural health and the environments that shape our well-being with industry experts and thought leaders. I'm your host, Daniel White, Principal at Pineapple USA, and in today's episode, we take you to Macon, Georgia, to revel in the transformative power of design in behavioural healthcare. We'll be focusing on River Edge Behavioural Health and their new facility, the Crisis Services and Diagnostic Centre, a place where architecture and empathy work hand in hand and the built environment becomes an agent of healing within the community in Georgia. We'll look at how this facility has embraced a therapeutic approach to design, prioritising calm, patient dignity and safety in every detail, from the spatial layout and lighting to materials and outdoor access. And you'll hear how these intentional choices have gone beyond aesthetics to shape behaviour, support recovery, and deliver measurable positive outcomes for service users and staff alike. Joining me today are two extremely busy and successful industry experts who are instrumental in bringing this project to life. We've got Greta O'Dell, River Edge's Chief Intellectual and Developmental Disabilities Officer, and Rachel Azar, Project Manager at Azar Walsh, who with her team was responsible for the concept and design of this amazing project. Hello and welcome to you both.
Hello, thank you for having us.
Thank you.
It's our pleasure. So just to jump right in, Greta, could you maybe tell us a little bit about River Edge and what makes this project, this facility so uniquely different, not just to any other facility in Georgia, but also in the country?
Yeah. So first, thank you so much, Daniel and Pineapple, for allowing Rachel and I to participate in this conversation. We're really excited to share about all the changes and all that's happening here in Georgia. But at River Edge, we're a community service board, and we have been around since 1950. The Central Georgia area. Community service boards are comprehensive providers, which means we provide mental health, 24-hour crisis stabilization, substance use disorder, and support for people living with intellectual and developmental disability. This most recent endeavor, which you've already mentioned, is a one-of-a-kind facility, is really coming from a multidisciplinary team approach that's going to include psychiatrists, nurses, social workers, board-certified behavior analysts, and medical specialty physicians, as well as physical, speech, and occupational therapists to provide that holistic care to the individuals we're supporting. The facility is 34,000 square foot, and it's a collaboration with our Department of Behavioral Health and Developmental Disabilities. That's our state organization. And we have brought to the table as well Mercer University School of Medicine. So it's going to be a teaching facility. So this facility is not only going to support the stabilization of a behavioral crisis, we're going to work at addressing those adverse behaviors for individuals living with intellectual and developmental disabilities that many times are caused by treatable medical, environmental, or social reasons. What makes this facility different and unique to Georgia, the Southeast, and as you mentioned, throughout the United States, is that holistic approach of care. There are many other facilities across the United States that offer the same services we're offering, just not in one building. And so that's really what makes it unique, is that if we have an individual that needs immediate medical care, we will be able to provide that at this facility.
That's incredible. That's amazing. So just being able, that patient to be able to have that consistency of being within your environment, which I had the pleasure of attending the ribbon cutting, which is an amazing facility, and also be able to receive all the care they need under one roof. What kind of benefits do you think that brings to your residents, Greta?
Well, I mean, we're quite new. We've only been in operation right at a month. However, we already have seen some great strides. We're currently supporting 4 individuals in that facility. We have the ability to support up to 16 at one time. But the very first admission that we have has she came to us. She had been 6 months in an emergency room. No other facility could provide her the supports or care she needed. Basically was staying in her bed 24/7, had not been outside, seen exterior light in those 6 months while she was in the hospital. And so she's been with us now 3 weeks. She is up out of her bed. She's back eating. She's talking with staff. She's walking. She was wheelchair bound when we first got her. So she's now actually able to physically walk out of her room out into our day area. Very interactive, working on a schedule. We have a couple of other individuals on the unit who are much earlier in their stabilization, and she's been able to verbalize that the noise bothers her. She needs her quiet time. We have introduced her to a sound machine so she can kind of use that to help distract her and all. So, she asked to go into our calming room on a regular basis so she can kind of have her private time. So, we really have seen a 360 in what was going on with her from the time she was admitted to now. And she's only been with us for 3 weeks.
Wow, that's incredible. Just understanding how your environment and having the right environment that is a therapeutic healing space really changes patient outcomes. And last question before I ask Rachel a question, Greta, how has this whole facility and build? Obviously, there was a lot of people at the ribbon cutting. How has it been received by the community? Because I know COVID did a lot to destigmatize, this type of care and behavioral health care in general. There's a lot more awareness now, which is fantastic. But what have people been saying within the community there in Macon?
Well, they're excited about the ability, especially once all of our medical services get up and going, being able to access those services all in one place for the individuals that are supported on an outpatient setting. I think probably the biggest kind of hesitancy community-wide right now is not wanting it to become a long-term care facility. And so there is lots of questions and concerns. Do we end up turning it into a small institution, which is not the intent at all. Our plan is within 90 days of services, someone will be able to be transitioned to another provider, back to their home, or either some transitional type housing that the department is developing outside of this facility.
Brilliant. Thank you. So, Rachel, when you started working on this project with Greta, and I know that you guys worked really, really closely together. You previously shared with me the advantages of that in your relationship together. What was your shared vision of what that therapeutic environment should look and feel like? And how did that vision evolve through the actual design process?
Well, fortunately, we were so blessed to work with River Edge. First off, want to say that the River Edge team is an excellent provider, and they are very involved from the very first stages of programming all the way up to the life of the project. And with every step of the way, Cass Hatcher, the CEO, they're involved pretty much every step of the way, and it really makes a difference. And even with those very beginning programming moments, Greta and Cass can really connect us with their clients. And we were able to even go see their patients and clients and get feedback from the actual individuals on what type of environments would they like to see, what kind of spaces would be most important for them, what was their envision. So I think that working closely up front in those beginning programming stages and having them connect us with their clients and really getting that firsthand experience of their voice really makes a difference for a project. And River Edge is a big organization. They do so many things and lots of different buildings. So it's almost every time we do I work with a facility with them, it's kind of a journey. So we kind of start all over again. We learn from each project to the next. And from there, in those initial stages, and like Greta, we were hand in hand from start to finish. And I think that really created some beautiful moments within the space of this building and some really creative, innovative solutions and some problem solving. And that matters because without their team and their feedback, it really eliminated potentials that could have been problematic later down the road. So the integrative approach to design with the team is very important. And by the end of it, me and Greta got really excited, and we worked hand in hand in a lot of very specific details. And I think it was super successful. And I do appreciate her time and Cass's time because they have full-time jobs, and for them to show up to every OAC meeting and sit down with the architects and builders and listen and walk through buildings, the building being constructed and seeing the 2D plans come into 3D. There was a lot of feedback from them, and we do appreciate that, and that's hard work. And at the end, you can really see that does matter.
Absolutely. I love that. We talk about really that interdisciplinary approach. We can't have too many stakeholders in the journey to really destigmatize these areas. One example is, I get ideas as I go. I saw your calming rooms and what you did in the calming rooms, and we talked about it. One was the beach, one's the forest.
Yes.
And the patient can choose whether they want to go to the beach or the forest. But I couldn't believe that those were actually soft walls. Just for patient safety, but it was actually a printed soft wall. And I've actually recommended that to a lot of other facilities since
Yes.
since being out. So hopefully there'll be a lot more calming rooms like yours.
Yes, and that was a very perfect example of this integrated approach from the beginning. And when Greta approached me and said, "We need padded walls," and she knew that she had this vision, and I fell in love with her vision so deeply. And she said, I really want it to have a print on it. And we sat on it, we thought about it, we researched, and we had to come up with a solution that was not in your face. When you look at behavioral products and materials, there's just not this exorbitant plethora of let's grab from this and solutions. So the manufacturer that she found was, it's an athletic company that, they print on pads for gyms and sports. And it took that vision of just saying, hey, I want to see the feeling of a beach and the feeling of a forest and the calming. And I said, all right, let's sit down. How are we going to do this? And it was just a beautiful collaboration of her vision. And I said, okay, this is how we can get it done. Let's look at these images. And then even from that, the furniture, the way the furniture and the fabrics, and she was so involved with looking at every fabric and what fabric looked good with the colors and the vision of the forest, and which the recliner as sitting in the beach and how that looked with the colors and the fabric on that chair, and the whole marriage of it. It was quite stunning. And she really wanted her clients to have that feeling. And I just think that was a quintessential perfect example of those innovative solutions that you have to think outside the box with some of these types of rooms that might not be obvious. And I think it was fantastic. And I appreciate her help on every step. So it's just one of those great examples.
Thank you, Greta and Rachel, for not accepting the status quo of institutional products. And this is really, this empathetic approach to design really comes through in your project. Imagine this was your family member. Imagine this was yourself. That's how we've got to imagine these projects when we're in the design process, which I think you guys have really nailed. Greta, tell us then, moving on to maybe some of the biggest challenges you faced, whether logistic challenges, financial challenges, legislatory challenges. What kind of problems did you come up against in working to achieve your therapeutic goals within, realistic constraints?
Well, this is really a difficult question for me because usually what you find is financial support or having the money to build the type of facility we built. But we were really lucky here in Georgia because our state legislator over several years have committed a portion of the budget and a quite healthy hunk, like about $8 million a year for the past 3 years for us to be able to build this facility. And then they're going to continue putting money in the budget for us to operate this 16-bed facility. So working with the Department of Behavioral Health and Developmental Disabilities has really they have given me the freedom to really kind of dream and develop a facility that really is different. I kind of worked with them and challenged them and said, we can't do things the way it's always been done. You're asking me to have different results, then I need to try some different things. And they've really given me the freedom to do that. And so the biggest challenge really is going to come down to staffing and being able to find enough staff to provide the support that need to happen. Because logistically, we've had a great team. As Rachel described, she and I really did spend a lot of time together in just trying to, I had the vision about those walls, but I had no idea how to cut and snip a picture and make it fit around an entire room. So it looks like it's one large thing. I could tell Rachel what I wanted all day long, but she had the skills and the ability to be able to do that so we could send something to a vendor for them to create such a great product. So my biggest thing is going to be really about having enough staff to provide the supports because we have a waiting list. We currently have 4 individuals there, and we'll admit as soon as I can get some more staff onboarded. Our current staffing ratio, because this is the highest level of care that someone will receive, is a 1-to-1 staffing ratio when they first come in. So you can imagine running 24 hours a day. We're needing, 40 staff a day to be able to staff this facility. And then, and it's running 7 days a week. So once we're up and going completely, this facility will provide support to 16 individuals around the clock. And that support being provided by about 100 people during the work week. So I guess the other thing I can say is we really did try to spend some time also in creating some spaces for the staff in hopes that if I can get them in the building, I'll be able to keep them because we tried to do some really innovative things around giving staff the same space, a place they can go for break. They can also use those calming rooms and the sensory rooms that we've created if they need some time away from the individuals for them to kind of regroup and also do some self-reflection and all.
Yeah, that's incredible, Greta. And for anyone that's curious as to what your calming rooms look like, we can pop onto the case studies section on our website where we've got some nice photography of the entire unit, but the calming rooms as well. So I love that you mentioned staff retention there, Greta, and that's also a shout out from Greta that she's recruiting. So anyone that's listening that may be interested can hit you up, Greta. So, but no, I was gonna talk on the staff retention point of view, and I was speaking to another subject matter expert who was telling me that some of their staff were actually choosing to come back into work on their days off because they cared so much about the purpose, and they were actually spending time maintaining the gardens You guys have got an incredible outdoor space as well. And I'd love to, get an answer from either one of you really on how you feel that garden really supports your recovery efforts for each individual and encourage that socialization and also the energy that you can get from physical activity.
Yeah, I mean, I can talk a little bit about it and then let Rachel talk to them about the design and all. So, yes, it was very important for me that we had space outdoors, that it's right off our dining and living area. We have large glass windows, so there's always this natural light coming in, but the individuals can also go outside and eat at lunchtime or dinner time or even breakfast. Whenever they want, they're able to go out, also eat. So it was important for me for it to be an outside space, just like we have in our own homes, that they're able to kind of come and go, be able to enjoy the outdoors. We do have some outdoor activities. We put in a small basketball court, so the individuals can get that physical activity. Again, we have not used a lot of that space yet, simply because we're have only been open for about a month. There's one particular individual who probably spends about 30 to 40% of his day sitting outside. He really loves the outdoor area.
Incredible.
Rachel?
Yeah, to just add a few things, I think Greta pretty much described it pretty well. We did add a few planters to get the greenery aspect. The basketball, we have pavers, so it doesn't look like your traditional basketball. It's almost a courtyard that has this slight, has that physical activity component to it, but it also has a relaxing greenery to the space, and as well as safety. This is a safe environment. It's enclosed. Individuals are there to be protected, and I think the lighting, as Greta said, with the floor to ceiling windows, you can be inside and experience the outside, because we are in Georgia and we do have pretty difficult summers that could be a little hot and humid. But if you sit inside, you almost feel like you are close enough that you can see the greenery, you can see the sky, you can see others, if playing basketball or just being like you're in a community with others. But also, if you feel like you want to be a little bit more in your own space, you're able to do that kind of with the connection to where the courtyard sits in vicinity to the large community area. So I think it did work well. And as Greta said, I'm happy to hear that the individuals are already enjoying being at peace in that space.
Yeah, that's incredible. And I love that you mentioned that natural light, circadian rhythm being so important to improving sleep and mood. And obviously that's de-escalating in itself.
Yes.
So yeah, to that point of having a space that's inherently de-escalating in terms of the built environment, Greta, could you maybe tell us how many times that you restrain patients within your unit?
So we actually have a no restraint policy.
Love that.
They're not going to be using restraints at all. We use a crisis intervention program called Mindset, and they have really worked with my administrative staff and my BCBA to actually create a pad system to that as well, really kind of for some staff protection. So if individuals are violent, they can use the pads to put between them and the individual, or put pads between the individual and the wall if they're banging their head, and really kind of doing some guided kind of reinforcement, instructing the individual to maybe go to the calming room so they can spend some time. We have lots of items there in the calming room area. And so our calming rooms would look like a traditional seclusion room, except the doors do not lock and the doors are not shut unless the staff member is actually in the room with them. So it allows for the individual to not feel trapped and us to really kind of provide a lot of verbal de-escalation and kind of working with the individual to kind of talk through what upset them, and do a lot of that debriefing right as the individual starts coming down.
That's brilliant, Greta. And I love that you don't physically restrain. I think, the kind of replacement of what would be typically be a restraint room with a calming room is absolutely brilliant for patients and staff alike. Often we see corridors down to a restraint room, and that can be very poorly received in terms of the patients in that unit. That's where the bad people go. It just really removes from what we're trying to do in terms of de-escalating and rehabilitating patients.
Yeah, the one individual that pretty much was being restrained almost daily at the emergency room, of course, she has not been restrained at all since she's been with us, but she actually asked, can I go to the calming room? Can I go in there and just sit? And now she'll go in there and sit with her sound machine and just kind of relax. She'll say, I'm getting agitated. I'm getting aggravated. Can I please go in there? And so that's really going to lead to us when we start talking with potential providers or family members to really tell them she needs to have a quiet space. She needs to have a place outside of her bedroom that she can go when she's feeling upset. So we're really hoping that so far, it has been used exactly the way I envisioned it to be used.
Brilliant. Brilliant. Rachel, can you maybe walk us through a specific design feature, maybe a layout or a material choice or a lighting strategy that was implemented with therapeutic intent, and whether you or Greta can speak to what outcomes that specific feature has resulted in?
Sure, yes. There's a lot of different things. I think that the new way of designing for behavioral health is going in such a positive, beautiful direction. And of course, colors and nature are some of the obvious, wonderful things we can do. But I just wanted to hone in a little bit on some things that aren't as obvious when you walk in a space, and you may think, oh, this looks nice, and that's interesting. But one thing we did at this facility is knowing that sound was something that we need to really work on. And like Greta said, it's a sensitive to a lot of patients. We need to be very cautious of what we can do to add an extra layer of sound acoustics, and where could we do that. And one place we really went into a lot of time and attention to detail is that the ceiling. So one of the spaces where the dining kind of connects to the living, we did it's pretty elaborate for a ceiling. And when you walk in, you're kind of, oh wow, what is, it's kind of interesting. But the lighting is integrated within a series of acoustical panels, which are very beautiful colors that complement the rest of the spaces and within the building. And they have these laser cut designs, so they have a beautiful interest to them as well. So what those sound panels do, they provide an acoustical property, and they are actually just mounted to the ceiling, but not just applied. Of course, you could just glue them up there, but we took a lot of time to really integrate the sheetrock and inset them within the lights, and also kind of in a geometric shape to where we have these wood veneer slats that also have an acoustic backing to that material. So it's a hybrid of lighting, sound, dampening properties, visuals, beautiful to the eye, kind of interest, feel good, elegance. And I feel like with all those materials, we really were able to accomplish quite a few things in one element, which was the ceiling. And in those spaces, that was most important. And so where we did have a lot of gathering spaces, within the building, such as there's activity rooms, visitation, lobby. So where we had those more high traffic, high density, a lot of conversation, we tried to use the acoustical panel, wood inlay, and the strip lighting. And we tried to use these designs within those areas just so we could have a good intention about sound management. And with that, we also try to do that with the flooring as well. If you're familiar with LVT, a lot of it can have a very clicking sound when you walk across it. You hear a lot of foot tapping and
Absolutely,
traffic, and that LVT has taken over a lot of commercial projects. But this one specifically had a very innovative backing to it. It almost kind of had a comfort level to it, which gave sound transmission dampening. So when you're walking across it and someone is in their bedroom trying to relax or be in a calm space, and they don't have to hear, 3, 4, 10 people walking up and down their corridor on their way to their bedroom. So we really tried to hone in on doing anything and everything we could with traditional architectural materials that could apply that extra layer of sound. And every little bit does help. And when you kind of make that envelope of floor to ceiling to wall, we do our best. Now, we can't eliminate every sound possible, but like Greta said, she's able to work with the patients and sound machines and whatnot. But we really tried to hone in on that one specifically. And one other one that I think is important that doesn't get talked about as much is a wayfinding. Signs are in buildings, but sometimes they aren't as clear. And, but what we like to really try to do in these spaces is give wayfinding with color, material, patterns on floor. And so it gives the patients a sense of self-independence. So one example is if they are transitioning from the activity room or the dining area, that look, although it complements the other parts of the building, the floor and the ceilings and the colors when they go to their bedroom almost gives them a sense of, oh yeah, this is how I go back to my room. Or we took all of the restrooms and kind of inset them slightly and painted them this nice kind of terracotta color. So if they're somewhere and they need the restroom, they don't have to always look and say, oh, where's the bathroom? Where do I go? So having that little bit of sense of independence by showing colors and patterns, it helps them visually navigate themselves within that space, and it kind of gives them a little bit of more empowerment. So it's small things, but I think in the grand scheme, they help and they give the patients a sense of self-worth and a voice. And so those are just a few little things that I thought of that maybe you don't really know they're there, but they're not as obvious, but they are effective.
Yeah, no, that's great, Rachel. And when I was there, I actually noticed that you've got, two different kind of, let's call it two different sides of the building.
Correct. Yes.
One is you've utilized our sagey green color quite a lot, and the other are kind of more pastel blue color.
Correct. Yes. So those were the wings. Those were, yeah. I like how you honed in on that. So the bedroom, the actual rooms where the patients would go and have their quiet time with their bedroom where their bed was. And if you know anything about walking into a hotel and you go down a long corridor, I mean, for any individual, it's very, it's like a tunnel. You kind of get like this very monolithic confusion. Look at the numbers, that's not effective. So what we like to do is minimize long corridors. So we had 3 basic wings centralized by one nurse's station. And within those 3 wings, they were color identified. So if you get to the centralized point and oh yeah, my room is in the green. And so they just naturally, they gravitate towards their color. Or I know my room is the blue. It just helps them. It's just an ease, they don't have to feel confused or lost. And those are just things we like to really eliminate, because if we can do one little thing that gives them something to feel relaxed, and that's, I think, it's not hard, but it's just having to be intentional about ideas and how to make them feel more comfortable.
That's great. I love hearing about all those design features. Thank you for sharing that with us, Rachel.
Yeah, sure.
Greta, I know this is probably going to be a hard question, but if there was one element of your unit that you're particularly proud of, that you and Rachel brought to life, what would you say that was and why?
Whoa. So for me, it would probably be the calming room is what I would identify, just because it's so different. I mean, I love the sensory rooms that we did. I love kind of the large area where everybody can either eat or watch TV and all. And how we chose to put the wall coverings in there and really make them about Macon and Georgia. But if I had to pick one, it would be the calming rooms, just because it was kind of a dream to being able to not have such a sterile room turn into something that was so beautiful. I mean, I would love to just go in there and spend an hour and take a nap. I mean, it really is very soothing and a comfortable space, which is not what you usually find in that type of area.
Brilliant. No, that's great. They were the nicest calming rooms I've seen on my journeys. So we're going to need to wrap this up soon, but I'm going to do a final question, which both of you guys can answer. So what lessons from developing this facility would you offer to others that are designing spaces also for vulnerable populations? And then what's the one thing that you think should always be considered in therapeutic design?
So for me, the lesson learned would be to always remain person-centered. It is at each step of the process, and as I walked into the facility, I always kind of went back to what I like to be come here for treatment. Is this the type of place I would want my family to come if they require treatment? If I was going to be here for more than a few days, what would I like to have around? And so being person-centered also lends itself to, because we are a 16-bed facility, for us looking at that wide variety of fabrics and lightings and surfaces and even the different kinds of furniture. I mean, we did not just go with one style of furniture. Our goal was we wanted it to be not bland, not sterile. We wanted the treatment space to also be clean and tight, be able to be cleaned easily. I wanted it to be a space that looked like a livable space and not all the furniture was exactly the same. Everything's not exactly the same color. And I think we really achieved that. And that's really because I think we had such a great relationship with Azar Walsh. This is not the only project we've worked with them on, so they kind of know us and we know them. And so I would tell other providers, if when they go into something like this, they really need to build a relationship with whoever their architect is to really be able to kind of go back and forth to have those discussions. I mean, Rachel and I went to Atlanta and stayed the night to really kind of be able to go to a vendor so we could see all of the fabrics that you had to offer. So we could pick those fabrics to match the wall coverings and all of the other fixtures and all of that comes together to really create that therapeutic mood.
Brilliant. Thank you, Greta, for such a detailed answer. Rachel, what would you say?
Yes, thank you. Greta said it very well. And I think I would definitely say what she said about the collaboration and very key. What we did together and the things she offered me as far as knowledge was very important. Just because every facility is different, even River Edge from facility to facility. And if I don't know exactly the everyday function and flow, it's hard to get the best space possible. And without that, I don't think you can get a successful project. And so, like Greta said, the collaboration is key. And so I think that's really important. And then as far as just things that I would offer is moving forward in the behavioral health and empowering the environment for these individuals is just, I always try to think about just what is it, how am I going to make it feel good? And can I give them a voice and a sense of place in the community that is supportive and compassionate and that makes them feel included with the elegance that they deserve just as much as everybody else. And then being able to incorporate a facility that's also going to nurture in the ways that they need to be nurtured. And that hybrid is a beautiful thing. And I think now we're seeing so many wonderful facilities that are coming out, and it's exciting to see the transformations over the years and where we're going with this. And I think it's great. Just the voices can be heard of these individuals because they deserve spaces just like everyone else, and care and provide whatever they need. So I'm very excited to do more. This is my favorite type of program, and all the programs that types of facilities I've worked on. It's very rewarding, and to know that what you're doing matters, and that the faces when people walk into a space and the way they glow and light up, it's really heartfelt and touching, and it gives everybody a feel good in their heart. And I feel blessed, and I want to thank River Edge so much for all the opportunities that they've given us, and I hope to continue to serve and do positive things.
Yeah, I love that sense of purpose that all of us get from doing this, and understanding that we're not just providing a product or a service, we're changing lives in healthcare, and we're changing lives for individuals that really need it. So yeah, a brilliant job by River Edge as well. So that brings us to the end of this episode of Healing Spaces. A huge thank you to Greta and Rachel for sharing their invaluable insights and the story behind River Edge and their new crisis services and diagnostic center. This project really truly exemplifies how thoughtful design can transform lives. If there's one key takeaway from today for me, it's this: when we put empathy at the heart of design, we don't just build better facilities, we build hope, dignity, and a path towards recovery. Thank you all so much for listening. I'm Daniel White, and we'll see you next time as we continue to explore how healing environments are shaping the future of behavioral healthcare.